Thank you, Karen, and thank you everybody for giving up your lunchtime really to come and listen to me share some thoughts with you around risk assessment, and in particular about how to articulate your analysis in relation to risk assessment. Because I think it's fair to say that in our line of work, that many people are able to undertake risk assessment. What they often struggle with is how they show they're working out to others. And that's a kind of critical skill. It's in terms of why do we do risk assessment? Those of you that are registered workers in the field will know that the codes of practice for social workers and for nurses are absolutely littered with references to your responsibilities to protect people from the risk of harm, and to ensure that people are able to live full lives. There isn't a discrete legal framework around risk assessment, but it's true to say that without undertaking effective risk assessment, all of us individually and certainly all of you corporately are at risk of certain legal repercussions. And I've got a case later on that I'm hoping will illustrate that for you. But our primary purpose in undertaking risk assessment is to secure autonomy for the person that has been abused. What is it? What's presented the risk to them, and how can that risk be mitigated to minimise the likelihood of them being re-victimised, or the others, what I call extended victimisation, where that risk might be transferable to others in particular settings. And the principles around risk assessment are about promoting those positive outcomes through harm reduction. There's no such thing as zero risk. You can't take risk out of people's lives per se. But our aim then is to maximise their autonomy with minimum intervention. Now, it might take a few of you by surprise, but I intend to introduce the models around risk assessment, first of all, through chainsaw safety. It's obvious really in terms of adult social care, I'm sure. But actually, if you can risk assess a chainsaw, you can actually risk assess anything. So my first question, and I'm probably going to need in this kind of forum to answer the question myself, is that chainsaw a risk? Some of you who've got partners who maybe are buying chainsaws in B&Q, petrol-driven chainsaws, will possibly have a view of this. And I guess one of the side benefits of being able to share this presentation with you is that I have a particular concern for people who use chainsaws. Sorry, that's I just waved to my wife who's just leaving in the background. So that's put me off a little bit, hasn't it? Chainsaws then, yes. These are machines that they don't take hostages. You can effectively go and buy yourself a petrol-driven chainsaw for £99 out of B&Q and go home and kill yourself with it. These are extremely dangerous tools. So, in terms of, is it a risk? Well, no, it's not a risk. It's actually a chainsaw. But there are risks associated with using a chainsaw, and they effectively break down into a number of elements. Firstly, there are particular hazards that are associated with using a chainsaw, and as a consequence of those hazards, there are dangers or harmful outcomes that could occur for the individual using a chainsaw, or even others that are around the individual using a chainsaw. And what helps us estimate the risk around that are what we term probabilities. What's the likelihood that harm will occur in the presence of a particular hazard? And measured against that, in terms of the probabilities, we can look at what resilience there is, and what control measures we might be able to put in place that either reduce the harm or reduce the probability. But if I just share with you one of the hazards of using a chainsaw. One of the hazards of using a chainsaw is a phenomenon they call kickback, which is where the saw, as you can see from that picture, on touching the wood that you're cutting, will actually fly back, and the usual arc of that kickback is around the carotid artery in the neck. So the hazard is kickback. The potential harm is facial injury and possible fatality if it does touch your carotid artery in your neck. And the probability of that outcome occurring can be affected by a number of things. And this is where your general person, your standard user of a chainsaw, somebody who's just a domestic user, bought it in B&Q, may not understand the dangers that are inherent within that machine. So kickback can be affected by things like chain tension, and also the correct sharpening of the tool. So if you don't keep your tool effectively sharpened, you increase the likelihood of kickback. Thankfully, chainsaws are they have some inbuilt safety features, and one of those inbuilt safety features is what's called the inertia brake. And at the front of the saw there, you'll see just over the handlebar, there's a blackened area, which is the inertia brake. As soon as that saw kicks back, your hand touches that brake and it locks the chain in place. This is what we would refer to as internal resilience. So it's safety measures within the person, or within, in this case, the tool, that would actually promote harm reduction. However, the chainsaw, although it's got that brake, it can't actually it can't control where you're using it. And one of the hazards, as I mentioned earlier, is this incorrect chain tension. If you haven't got your saw tensioned properly, then it will increase the risk of hand injury, because it will wrap off, and the first place it's going to wrap around is your hand. So, as there's no internal resilience, we need an external control measure. And the external control measure to mitigate that harm are chainsaw gloves. As I said, the chainsaw doesn't actually know where you're using it, and one of the most likely points of injury when using a chainsaw are to the lower limbs. So once again, there is an external control measure that you need to operate, and these are called chainsaw boots and chainsaw trousers. They're made of a particular material called ballistic material, and this won't stop you getting injured. What it will do is it will reduce the intensity of the injury. So it won't, if you've got these trousers, what it does is as the chain touches the material, it fluffs up, and similarly it locks the chain in place. So it won't stop you cutting your leg, but it will stop you cutting your leg off. And that's the difference. So we can't have that position of zero risk, but we can reduce the harm by putting external control measures in place. And I will, at a later point in the presentation, start to translate this into areas of your practice that are likely to be more familiar to you. But I just really wanted to take us through what are some of the key concepts around risk assessment, so that you can use those concepts, if you like, as a formula to be able to describe risk to others. Now, as you see there, there is an area of the chainsaw trousers that doesn't contain any ballistic material, and it is in the seat of the trousers in your bottom. And the reason for that is that if you can cut your backside while using a chainsaw, you probably shouldn't be using one in the first place. So if I just take you through some of the other hazards then related to using a chainsaw, you've got flying debris. As you cut into that piece of wood, debris flies off, and that can come back. I think somebody might just need to put themselves on mute. I've got a bit of feedback here. If I could ask people just to check that they're on mute, that'll help. Thank you. So as I said, flying debris, and that the hazard is flying debris. The harm is potential eye damage. The saw has no internal resilience around that. So again, you need an external control measure, and that's the visor at the front of the hat. Similarly with the ear noise, you are going to be operating a machine that has an engine size of about 42 cc's. It's roughly the equivalent of a small motorcycle. And you're going to be operating that at high revolutions in close proximity to your ears. So the hazard is high level of noise. The harm is potentially ear damage, and therefore the external control measure to mitigate, to reduce the likelihood of that harm, are the ear defenders that you see on the side there. So, resilience. We've talked about two types of resilience then. There's the internal resilience, that are safety mechanisms built into the machine. And as we'll come on to see later on, safety measures that are built into the person's circumstances or to the individual themselves. And then there's external control measures, things that others need to do around the environment that actually reduce that risk as well. And finally, the individual operator. A lot of those factors, some of them lie within using correct PPE so that you can reduce the risk of damage to yourself, but also being correctly trained and understanding how to operate and to maintain the machine so that you reduce that risk of. Got a little bit of feedback. Can I just ask again if people can check that they're on mute? Thank you. So, I was a little bit busy on the fingers there. So in terms of describing risk, what we're looking for in risk assessment and risk management is actually to get to a place where you've got a tolerable risk. As I said, there's no such thing as zero risk. So the standard that we're looking for is that it's as low as is reasonably practical. And your formula, if you like, for calculating risk is identifying the hazard, then estimating the degree of harm and estimating the likelihood or the probability of this. And I've got some models that I'm going to come on to that will help illustrate this a bit better for you. So you're firstly looking, what's the hazard? What's the harm from that hazard? And therefore, what's the probability that harm will occur in the face of that particular hazard? But your mitigating measures are things like resilience and those control measures. So that might reduce your original estimation because you've got things in place that can either reduce the degree of harm or the probability of harm, thereby moving it to a position of a tolerable risk. So I mentioned earlier that there is no discrete legal concept of risk, but there are some legal frameworks that help us understand why risk assessment is such an essential part of our business, particularly in safeguarding. Everything in safeguarding is based around assessing the risk to the individual or to others. And the key legal concepts that you see noted there are the concepts of negligence and recklessness. These will be concepts I'm sure that your organisations will be concerned with, because the last thing that we want to be is in a position where we are subject to a negligence claim or subject to inquiry, safeguarding inquiry, as a consequence of negligence. And this links to the need for yourselves to be able to make defensible decisions. That's the kind of the key practice issue for us in risk assessment. And a defensible decision is one that you can equate with the body of knowledge of your particular professional body. So it's not good enough, essentially, to say, well, I did what I did because I did what Jay did. That might be okay if Jay's good at her job, but if Jay's not very good at her job, that's not a defensible decision. Whereas if you can reference your risk assessment, your decision making against what the theories, concepts, codes of practice are for your particular area of practice, then you're in a much stronger position to defend yourself in that situation. But let me take you briefly through the criteria for negligence and the duty of care. Because the duty of care, I think, is a duty that we would probably all say that we're familiar with. And I'll ask the question about where in legislation is your duty of care outlined? If somebody can give me the answer at the end of this seminar, I'd be pleased to hear it. And if I don't hear it, then I'll return to that point in the question and answers. But the determination for liability in negligence for lawyers, they need to answer 3 questions. The first of all is, do you owe a duty of care to the person that's been injured? Secondly, then, have you breached your duty of care or the standard of care? And thirdly, has harm followed as a consequence of that breach? And the question then arises as to whom do you owe a duty of care? I guess for many of us in our day-to-day working practice, we would identify that primary duty being to the people that we provide services to, but also to our employers and possibly to our colleagues as well. However, in law, you owe a duty of care to anybody that you can reasonably foresee might come to some harm as a consequence of your actions or your omissions, things you've done or things you haven't done. So some of us, I'm sure, will be owners of cars, vehicles, and we use the roads around us. Well, you owe a duty of care to any other road user. So if I just illustrate with an example from myself, I'll invite you back for a cup of tea. Well, not all of you anyway, because I haven't got enough house is big enough to entertain everybody for a cup of tea. But if I were to invite you back for a cup of tea, and as we come through the door, I say to you, stick the kettle on, make me a one whilst you're at it, because I can be a bit cheeky like that. And I fail to warn you that my kettle has got a little bit of dodgy wiring. And you sustain an electrical burn from my kettle. If we apply the determination of liability for negligence, do I owe you a duty of care? Yes, I do, because I can reasonably foresee that you might come to harm as a consequence of my actions or inactions. Have I breached my duty of care? Yes, I have, because I failed to warn you in inviting you to use my kettle that you might experience some electrocution. And have you been harmed? Well, yes, you have. You have sustained an electrical burn as a consequence to that. Whereas if I just turn that around slightly differently, if knowing me well, as many of you might do, or not, as the case may be, you will know that I am the world's worst host. So if you're going to get a cup of tea in my house, you absolutely are probably going to have to make it yourself. You can't rely upon me to do that. So knowing that, on returning to my home, you think, I'm gagging for a cup of tea. I'm not going to wait for Jay to make it. I'll go and stick the kettle on myself. And again, you sustain an electrical burn. The questions the lawyers might ask there is, could I reasonably foresee that you would take independent action and go and have the cheek to go and stick the kettle on, make yourself a cup of tea without invitation? There you might have a different argument about, did I owe you a duty of care? Or 2, had I breached that duty if I couldn't reasonably foresee? I'll leave you to ponder on that one, perhaps. The skill in risk assessment is risk assessment. It's a very subjective process, because 2 of the axes, 2 of the kind of indicators or concepts that we rely upon in risk assessment is this concept of harm and this concept of probability, and they're both fairly subjective. We might all be able to agree on what the hazard is, but we're likely to have different individual perceptions of what the likelihood and the degree of harm is. So these models of risk assessment that I'm just going to take you through, they're ways of actually, if you like, communicating with one another and getting agreement about the overall risk. So The preferred models are what we call a model of both clinical and actuarial, because many of the models of risk assessment are based on statistical analysis. But as I said there, I'll come back to you a bit later on about that one. But if we just consider the case of Mrs. Partington. Mrs. Partington lived in Wandsworth, and she lived nearby a care provider, a care facility that catered for people who had a diagnosis of being on the autistic spectrum. And on one occasion, Mrs. Partington was out taking her constitutional walk on a daily basis, as she would do, and she encountered one of the residents from the nearby home who was being supported by two carers. My apologies for that. And this individual had an outburst, and she battered Mrs. Partington. She had quite significant injuries. And Mrs. Partington's solicitors sought a negligence claim. Against whom, do you think? I wonder. Well, it could have been against the individual. However, remember, the test is that you must be able to reasonably ascertain that somebody might be at risk from your actions or your inactions. Well, if the individual themselves was unable to regulate their own emotions and their behaviour, then it's unlikely that they will be able to anticipate that risk to others. So naturally, then the solicitors turned to the care staff who were supporting the individual out on that walk. And they did have a duty of care, and therefore, vicariously, their employers also had a duty of care. And the judgment was a very fine thing, because when they looked at the risk assessments, the recorded risk assessments, this individual was recorded to be predictably unpredictable. Okay. So she would, on occasions, have the occasional outburst, which could at times result in her becoming physically aggressive towards others. But there were no identified antecedents to this behaviour, so there was no identified pattern. And so the solicitors argued that the care provider, knowing that this person from time to time could be predictably unpredictable, should never have taken her out of the home at all. She should have been incarcerated within that facility 24/7. Now, their argument's not seeming to be quite so reasonable, is it? And understandably, the care providers, they put forward the argument that actually they had no lawful authority to detain this person in this facility. Bear in mind, this was a case in the late 80s and would have predated the current arrangements that we have under the Mental Capacity Act now, and your responsibility and authority to apply for a deprivation of liberty safeguard. But that wouldn't necessarily mean that you would never let somebody out of a care setting. So their next argument was then, well, okay, as you haven't got any lawful authority, when the person is outside of your care facility, you must have them under restraint on all occasions. Again, it's not starting to seem quite so reasonable. And what the care provider argued was that they argued that actually in familiarising the person with their local environment, they were employing principles of normalisation, which was an industry standard. So they were able to benchmark and reference their practice against the practice of their facilities and their kind of their work environment. So they were able to offer what's called that defensible decision making. I would suggest that actually, had their risk assessment been more specific and that they'd articulated the risk more overtly, then probably Mrs. Partington's solicitors would never have gone near it in the first place. And so for yourselves, that's one of the important things about making sure that those risk assessments are well recorded, well documented. Because in that particular individual's case, there was a possibility that she could become aggressive. However, just because it's a possibility doesn't make it a probability. And the skill is estimating that probability that enables you to offer a defensible risk assessment. So, risk assessment then, essentially it's defined as the evaluation of the likelihood of possible loss outcomes in the presence of particular hazards. And the degree of dangerousness is determined by the probability and severity. And some of you who I'm sure will have done reading about this will see this is what we know as the actuarial model of risk assessment, and you'll see it often laid out in this way. This is what your insurance is based on, essentially. If those of you who are drivers, your insurance premiums are based on the likelihood or the estimation, the insurance company's estimation of the likelihood that you are going to have a road traffic accident and cost them some money. And of course, if you've had previous road traffic accidents or cost them money, then they think the likelihood is greater in the future, therefore they increase your premiums. That's the way that works. But as I said earlier, many of us are able to agree on what we consider to be the concern, the hazard. Where we differ is on the consequences and danger. When I was working in the mental health services many years ago now, I worked with a particular psychiatrist, and both he and I had grown up in personal environments where there was a high level of expressed violence. His response to that is he is very, very sensitive to cues of violence. My response to that is I'm actually desensitized to cues of violence. So when we went out on mental health act assessments together, it could be quite comical at times, because if there was any suggestion of aggression or violence, I would struggle to get him through the door. I would stay in the situation probably a little bit longer than was actually safe for me to do so. And this is the value of when you operate risk assessment with others, because there's a danger that if you do risk assessment on your own, it will be subject to your own subjectivity. So at least in those circumstances, I could persuade him to come in to the setting. And when he said to me, Jay, I think we need to leave, I paid attention and left. So we were able to mitigate one another's subjectivity and have a much more grounded assessment of what the risks were. So once again, if I try and illustrate by example, right now down my street, we've got some workmen and they are digging a dirty great hole in the pavement. I've been and had a look. It's about 15 foot deep. It's a very deep hole. So in terms of this model, the hole we would identify as being the hazard. That's the source of concern. The consequences of the hole might be that if I encounter it and fall in, I'm likely to do myself a little bit of damage. But the likelihood, which is the risk, is affected by a number of factors, back to internal resilience and control measures. Now, fortunately for me, I have very diligent workmen in my area, and they have signposted about 200 metres up the road that there is a hole. They've gone to the trouble of putting those little plastic barriers around with the flashing lights on top as well. And they've tried to cover the hole with some sheet metalling, although there is probably about an 18-inch gap in that sheet metalling. And so the likelihood of me encountering the hazard, encountering the hole, has been mitigated. It's been reduced by putting these external control measures in place. However, if I paint you another picture, it's a dark winter's evening. I've been down the local hostelry and I've imbibed a few too many of those red teas. So I've come out the pub, I've fallen out over. I can't see where I'm going because I've lost my glasses. Some little scallywag has been along earlier on and nicked all the signage and thrown it down the hole with the flashing lights. So under those circumstances, the likelihood of me encountering the hole is increased because all of the control measures have been removed. So the risk rises in those situations. Except you'll be pleased to know that our landlord has heard about said scallywags a little bit earlier on in the day, and so he's been along and he's thrown 5 mattresses down the floor, the hole. So in terms of risk management and the estimation of risk, it's lower than it was previously because although the control measures have all been removed, there have been some additional resilience that's been put into the situation so that even if I fall down the hole, I'm likely to have a softer landing. Yeah. Safer thing to do would have been for phone me a taxi, get me home safely in the first place. But we won't dwell on that example for too much longer. So if you look at lots of health and safety documentation, you will see what they term as these risk assessment matrices. And essentially, these are, when I talked about those descriptors of probability and harm, because they're subjective, what they've done is they've identified descriptors and they've assigned a numerical value to those descriptors. So this is a way of trying to make common our discussion about risk assessment, so that I often say to my staff, when you come to me and you say, I need to talk to you about this safeguarding inquiry, Jay, because it's high risk, you can expect me to say, for what reasons? And what I'm looking for is a description of the danger, the consequence, and the likelihood of that consequence, and any internal resilience or external control measures that have been put in place that would reduce the likelihood or the harm. So that's why I'm asking staff to articulate that. And you'll see there in this, you get these in all sorts of formats. They come in 4x4, 5x5, or as many descriptors as might be helpful to differentiate the level of harm or the likelihood of harm. But you see there in terms of the severity, if something's trivial, it's given a value of 1. If it's a fatality or a major injury, it's given a value of 4. And then if we look at the probability, again, you've got similar values. So you've got something that's extremely remote to likely or frequently to occur. And the idea about these models is that you find the numerical value that equates to what you think is the appropriate descriptor in your circumstance, and you calculate the risk based on the severity. So you times that, and in these documents you will find matrices that set out high, medium and low, usually on a colour chart, that enable you to say, well, I've estimated it as low for these reasons. There is an alternative to this, which is what I call the descriptive analysis rather than the prescriptive analysis. And in safeguarding, it's just a succession of questions that we ask about a situation, because technically what they do is they do exactly the same as the prescriptive model. If I just take you through those questions. Firstly, I'm asking, what's the extent of the abuse? Well, that's a harm measure, isn't it? Secondly, was it a one-off event or is it part of a long-standing relationship or pattern? Because that's a likelihood measure. Having said that, if your one-off event is murder, then that's still pretty going to make it pretty likely or pretty serious. And there's a danger sometimes of us conflating the word seriousness with risk as well. But the impact of the abuse on the vulnerable adult or on others or children, again, that's a harm measure. The little rogue in there possibly is the intent of the person, but behind that is an indication of does the person's intention give us any indication about whether or not there's likely to be repetition of this event? You know, did they mean to do harm or did they not mean to do harm because they actually didn't know what they were doing was harmful? And if they don't understand that what they're doing is harmful, then the likelihood is that they're going to do it again or do it to somebody else. So we need to change that behaviour to reduce the likelihood of them repeating that harm to others. Just take you through a couple of examples from safeguarding around using this. So many of my examples drawn from practice now are from the days that I was working in out of hours in our emergency duty team outside of normal working hours. And on this particular occasion, I had a telephone call from a care agency who said, "Jay, we need to report a safeguarding concern to you because one of our care workers has administered a double dose of this person's medication. They were supporting somebody with a learning disability in a supported care situation, and they said, but it's all right because we filled out all the right paperwork." Okay, I says, that'll make it safe then. Because actually, your risk documents don't actually, your documentation doesn't make people safe. It's your actions that make people safe. In fact, they'd done much more than that. They'd phoned the on-call GP and established, was the medication going to be harmful to the individual? They said, no, sometimes we give it as a double dose, as a stat dose anyway, so just miss off the next dose and then resume the usual routine. They had suspended the member of staff involved, not because they thought they'd necessarily done anything wrong, but until we looked into it and made sure it wasn't going to happen again. All of that rests on us identifying the care worker as the hazard. And if it is, then all the right actions have been taken to reduce the risk of repetition or extended victimisation. However, if the hazard is that a double dose has been issued by the pharmacy in the dossier box, then we haven't got the right hazard. But there's a quick way of doing that. We can phone pharmacies and describe to them what medication is there so that they can tell us whether or not that indicates a double dose. So we can rule that sort of thing out. And my last example, before I give you opportunity to ask questions of myself, it relates to a woman that I worked with who was living in her own home in the community. She was a wheelchair user, and she had for very many years experienced domestic violence at the hands of her partner. And I was notified of another occasion because the police officer that I was working with called me and said, "We've got Mrs. So-and-so's husband under arrest. Jay, there's been another incident of violence at the home." On this occasion, she had not she'd not occasioned injuries that were requiring any medical attention, but she nonetheless was very shaken and disturbed by the events. So in terms of the risk, the identifying the hazard is the person who is causing the harm, i.e. her partner. In terms of the harm, on this occasion, she hasn't sustained injuries. However, there is an increasing pattern of frequency within which these events are starting to take place. But right now, the hazard is arrested. So they're in custody. Therefore, the likelihood of them being able to perpetrate further violence against the individual is pretty much zero. But we're just about to release them with bail conditions, which increases the likelihood that the individual will be able to re-encounter his partner and perpetrate further abuse. But in the intervening time, I was able to talk to the lady, and she said to me, "Jay, I know you and I have had this conversation many times over the past months. I've finally got to a point where I think I'm able to make a decision. I don't want him back. I've had my brothers over here. They've changed the door locks whilst he's been under arrest. I've identified somewhere, if he should turn up and we're able to get into the property, I've identified a contact and somebody who will come and take me and remove me to their property. He doesn't know the address." So she'd begun to develop a safety strategy for herself in those circumstances. So she'd used our external control measures were about to be removed, which increased the likelihood of further harm to her. But she'd utilised her own internal resilience, safety and support that was within her own community, her own circle of support. They'd done more in that, and they'd put in window locks and all sorts of things, and her brothers were going to be staying at the property for the foreseeable future, so she'd got company, and they were doing that on a rota basis. So shared with you the entire safety plan in that respect. So where our external control measures had been weakened because bail conditions can be broken, even when they are set with powers of arrest, that just means that we rearrest the individual and they're back in custody. She'd also drawn upon her own internal resilience to reduce the risk of gaining entry to her property and perpetrating further assaults against her. So I think that probably draws me to a conclusion in terms of what I wanted to share with you. So whilst I deal with the technology and shut the slide down, I will then try and get myself back up on screen so that I can respond to any questions that you might have.
Thank you so much, Jay. That was so thought-provoking, as always.